I had frozen shoulder a couple years ago.
Oh, you had the frozen shoulder.
And guess what? Nobody knows what causes it, and there's nothing you can do about it.
You know?
Like every ailment for women in their 50s.
I mean, right on. Amy Poehler highlighting her issue with frozen shoulder during a good hang chat with former First Lady Michelle Obama. It's a debilitating condition. It affects mostly women, and it can leave you unable to move your shoulder, making everyday tasks like washing your hair impossible. And here with everything we need to know, Dr. Jocelyn Wittstein, an orthopedic surgeon and sports medicine specialist at Duke. She is also the co-author of the Complete Bone and Joint Health Plan. Dr. Wittstein, good morning.
Thanks for having me.
There are probably people watching right now going like, oh my gosh, this is a thing. It has a name. I mean, frozen shoulder is a real condition. What is it?
Yeah, so many people have never heard of it, but they've had it.
Yeah.
It's seen you, but you haven't seen it.
Yes.
That's the expression. So it is an often atraumatic, meaning no injury, condition where people just wake up with a very painful, stiff shoulder. It starts with an inflammatory phase where the shoulder becomes extremely painful and starts to get stiff. And then there's a frozen phase where it's literally frozen. It's not painful anymore, but extremely stiff. And then it thaws, and this can take up to 2 years to resolve, especially if it's not caught early.
And who is at most risk for developing it?
So women certainly are the main group of people to get this, but especially women between the age of 40 and 60, so perimenopause, menopausal women. Also, people with diabetes, thyroid conditions, and then breast cancer patients can be at risk, especially if they're on a class of medications called aromatase inhibitors, which can induce joint pain in about 50% of people.
You've been studying this, the link between frozen shoulder and perimenopause. You presented a new study. You looked at that connection there. It still needs to be peer-reviewed, but can you give us a little sneak peek at what your findings were?
Yeah, I've been studying the relationship between the menopause transition and hormone therapy since 2020. And in the latest research we did, it was a survey of over 10,000 women. And what we found that is the women who are not using hormone therapy, basically about 1 in 4 of them developed frozen shoulder. And it was much more common in women who did not use hormone therapy as compared to those who did, about an 8-fold difference.
So does that mean that menopause is the cause of it in some sense?
Not necessarily. It's probably multifactorial, but we do know that estrogen has an anti-inflammatory effect on our joints and inhibits some of the cells that stiffen the lining of the shoulder joint. And we don't have definitive proof that hormone therapy makes frozen shoulder go away or prevents it, but we did see in our survey that over half of women who started hormone therapy after developing frozen shoulder had improvement in their symptoms.
So if not for the hormone therapy, what other kind of treatments are there for it?
So frozen shoulder is treatable at every phase. Ideally, we catch you early on, and one of the benefits of talking about this on this forum is that maybe someone will hear it and realize they have it. But we can treat it very early on with a steroid injection, like into the joint space, and that helps to calm the inflammation, and in some cases can cure the condition if you catch it early. Physical therapy is extremely helpful. It's important to keep the joint moving. Physical therapist will be your best friend besides your orthopedic surgeon. And then we can do surgery if we have to. Most people don't need that, but we can do a little surgery through small poke holes with a little camera to release the tight adhesions in the shoulder.
I mean, I am a side sleeper, and a lot of times will wake up with like a sore neck or my shoulder hurts, but that's not this. Like, what's the telltale difference between like sore neck and shoulder versus
The telltale sign of developing frozen shoulder is that you start to lose range of motion rapidly after this new onset pain.
Okay. Meaning like you can't lift your arm?
Right, so stiffness, like lack of rotation, difficulty reaching behind the back to fasten a bra, difficulty washing or shaving under your opposite armpit, just normal functions of daily living. All of a sudden you don't have the range of motion to do them. And women will oddly just tolerate this because they're busy taking care of other people.
Yeah, and it's kind of weird. It's like you don't think, oh, this could be related
and then they come in with Fro-Show, as you said.
Fro-Show. That's what all my girlfriends call it. It now has a nickname, so
I'm going to start using that because we call it adhesive cap, which adhesive capsulitis, but Fro-Show is better. I'm going to go with that.
A little more like zhuzh to it.
Yeah, I'm going to switch to that.
So are there any exercises or things you could do preventatively?
Yes. So if you have like a little prop at home, you could use a yardstick, or
here
we
comes
have
Gerard
these handy
with,
broom handles.
Okay.
Yeah. So, if you're starting to lose range of motion, just keep it moving. If you have a yardstick or a broom handle, you can grip like this. Let's say my right shoulder is the frozen one and my left one is the good. So I'm just going to grip and I'm going to push with my good shoulder and just rotate to the side. So keep your trunk stable, and you're just helping it rotate so you don't lose your external rotation.
Okay. This isn't looking weird, right?
No, you're just rotating. You can also do this with the yardstick. And I'm just going to show you one that you do standing up called a pendulum, which is very easy.
Do we need our broom?
No, you can put your broom down.
Well, you know what? This floor is terrible.
Yeah.
Sorry, I couldn't stop myself.
So this is called a pendulum. You just lean over and let your arm hang and just let it go in little circles.
That feels kind of nice.
And it feels really good to people who have this problem. Just a little traction on the arm.
Okay.
You can lift your own arm up with your good arm.
Yeah.
Up and down, just assisted forward flexion. You're just taking it through the range of motion you can tolerate. This is the opposite of no pain, no gain. Everything else in orthopedics is no pain, no gain. This one is avoid pain and keep moving it in the range of motion that you tolerate. Just keep it moving.
Okay. And so if you're starting to feel this, those exercises might help a little bit.
Yes, in whatever range you can that doesn't hurt too much.
All right, Dr. Wittstein, thank you. Appreciate it. By the way, for her beginner's guide to build better joint health, you can check out our website, today.com.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.